Breast reduction surgery comes with some risks other than the main risks of bleeding, infection, and wound complications. There is a risk that you're going to end up still being too large. There's a risk you're going to be too small. We have a discussion beforehand to try and gauge what size you want to be. A's, B's, and C's is not usually what we go by. We go by volume, and we will get a sense in terms of what you're looking for. But even with that, there is a risk that you could still be too large or too small afterwards. You could have changes or loss of sensation to the breast and or the nipple area. There is a risk of lack of blood supply to the nipple and the areola. And you can end up with something called nipple areolar complex necrosis. It's very uncommon, and it is usually in someone who's very, very large and with the breasts very low, but it can happen. If I'm concerned about the blood supply at the time of the surgery, I will generally take the areola off and graft it back on. It's extremely rare that I need to do that, but it is a possibility. You can end up with a fluid collection. Generally, you'll have a drain in the breast. But even with that, you can end up with a fluid collection. Try and avoid any twisting because that can create fluid. The breasts will drop over time, so you can end up with what's called recurrent ptosis or sagging, but that's just a function of gravity. Lastly is the risk of asymmetry. As you're not going to leave the orbital. I'm happy that they're as twin-like as possible, but they can heal asymmetrically. No two breasts are ever completely symmetric. We say they're supposed to be sisters, not twins, but we want them to be sisters, not cousins either. The risk of scarring is 100%. You will have scars, and we will have you on a scar regimen afterwards to try and minimize the appearance of it.